Hello, everybody. This is Dr. Jaffrey again. I'm a board-certified internist and gerontologist. Today, I had another interesting question that I would like to share. A patient had a COVID infection in the past and wanted to know if he could get the COVID vaccine. And the answer to this is yes. You should get the vaccine despite having COVID in the past. This includes the primary series as well as boosters. This results in increased immunity, increases immunoglobulins, the antibodies that attack the virus, and also gives further protection for any kind of reinfection. Only exception to this is something called multi-inflammatory syndrome, where the patient was in the ICU and COVID had infected and resulted in inflammation of multiple organs. So you've had COVID and you want to know when you can get the vaccine after the infection. It's actually after you've completed your 14-day quarantine, you can get vaccinated, whether it's the primary series or the booster. And the one thing that has been reported, and I did review the data on this, is that there's increased risk of side effects when you've had COVID in the past and then you get the vaccine. Your immune system reacts a little bit stronger. So they're the same side effects of fever, myalgias, but they might have occur with increased intensity because of the prior exposure. Now, you've had exposure to COVID, and now you're wondering if you should get a vaccine or not. And so the answer to this is you wait again until the 14 days, finish the 14 days, and then post-exposure so you don't expose other people, and then you can get the vaccine. The only exception and delay that I was able to find on the CDC website was the people who received antibodies. So if you receive the antibodies, then you have to wait 30 days, and the reason for that is the antibodies, they interfere with the immunogenicity of the vaccine. So the main thing to understand is that you should get the vaccine even if you had COVID. The guidelines regarding waiting 90 days or the 30 days were actually in the beginning, people were getting a lot of infection, and they just wanted to wait for people who had COVID to wait about 90 days, and so that the people who did not have COVID get the vaccine in the interim. So now that exception has been removed, so everybody should get the vaccine regardless if they had COVID or not, with the exception of the people who received the antibodies. Please, if you found this information to be helpful, please subscribe to the channel and help support making more videos.